everyone, my name is Katie Ross and I'm a fourth-year medical student from Dalhousie University. Today I will be discussing our project titled Minimally Invasive Procedures and Gender-Affirming Care, a Case for Public Funding. This study was co-authored by Dr. Sarah Fraser. She is a family physician from Nova Scotia who provides gender-affirming care at the Halifax Sexual Health Centre. She is also a writer, editor, blogger, and co-director of the Dalhousie Medical Humanities Program. Together, we have no conflicts of interest to disclose, and we did not receive any funding sources for this research. In the 2021 Canadian National Census, more than 100,800 people living in Canada reported their gender identity as transgender or non-binary. Although access to gender-affirming care has increased in recent years, the care gaps that remain are substantial. In the province of Nova Scotia, where we work and study, has the highest proportion of trans and gender diverse people in the country, yet the wait times for gender-affirming healthcare is long. This is despite the medical necessity of these interventions and the profound benefits they offer transgender and gender diverse people, as emphasized in the recently released Standards of Care for the Health of Transgender and Gender Diverse People version 8 or SOC 8 guidelines. Healthcare providers play an integral role in the transitioning process for transgender and gender diverse individuals. Currently, the most common treatments are hormone replacement therapy and surgical procedures, including chest and genital reconstruction. However, for many transgender and gender diverse folks, facial transformation and hair removal are key elements for attaining gender congruence. As such, there is growing interest in minimally invasive procedures, including injectable fillers, neuromodulators like Botox, and hair removal. These procedures have widespread appeal for multiple reasons. First is regarding access to therapy. To receive gender-affirming healthcare, typically a transgender or gender-diverse person's gender incongruence must be marked and sustained, but there's little guidance regarding the exact duration of incongruity required. Although the SOC 8 guidelines state that rigid assessment tools for transition readiness are not always in the best interest of the transgender or gender-diverse person, an assessment by a professional who has specialized training and working with this population is required. Unfortunately, waiting for assessment can take a significant amount of time. In addition to treatment wait times, the desired effects from hormonal therapy often takes months to years to achieve full effect. This is a period during which minimally invasive procedures could be considered. Another appeal of facial injectables and laser hair removal is their minimal risk and reversibility. Such procedures also present an option for those who are not considered to be surgical candidates, such as those with significant medical comorbidities. These procedures also have the potential of being widely available since they could be performed by a number of health practitioners, including nurses, nurse practitioners, dentists, family physicians, plastic surgeons, dermatologists, and others. In a recent survey of transgender and gender diverse individuals, those who received non-surgical facial injectables reported greater self-esteem, a more positive body image, greater gender congruence, and less anticipated discrimination from others. However, access to care and the cost of non-invasive procedures are barriers for many. Private and public insurance coverage for gender-affirming care often draws an artificial line between procedures considered to be medically necessary and those perceived as cosmetic. A recent paper by Asha and colleagues, published in the Aesthetic Surgery Journal, argues that refusing to cover procedures, both non-invasive and surgical, is discriminatory and can have damaging impacts on the mental and physical health of transgender and gender diverse individuals. The purpose of our study was to review the public coverage of minimally invasive procedures for gender-affirming care in Canada. We found that Manitoba and Yukon were the only two jurisdictions to cover hair removal. Of note, Yukon, known as a leader in gender-affirming care in North America, also covers facial feminization surgery. We did not identify any provinces or territories that covered neuromodulator, Botox, or filler therapies for facial masculinization or feminization. Next, we reviewed the public coverage of services in other countries. Reviews of the United States found that there was no coverage for many minimally invasive facial injections or hair removal, as these were deemed cosmetic procedures. When reviewing European countries, England and the Czech Republic appeared to be the only nations to provide public insurance for hair removal, but coverage for both countries was described as context dependent. This meant patients were required to have stringent assessments completed to show that the procedure was indispensable for their well-being to be considered for coverage. There is no coverage for injectable fillers or neuromodulators. So, how do we get these services publicly covered? First, we need to continue to advocate for this patient population and for coverage of their gender-affirming care. Next, we believe that government support for the provision of minimally invasive gender-affirming procedures could be accomplished through two routes. First could be the funding of billing codes for these procedures so physicians or allied health professionals can bill appropriately. And second could be through covering of the products used for these purposes under provincial pharmacare programs. In conclusion, minimally invasive procedures are a safe and timely option with proven therapeutic benefits in the field of gender-affirming care. The public funding for these procedures warrants serious consideration in a population that continues to face systemic discrimination and barriers to accessing care. Thank you.